Look, it was another great day. The Florida House has offered up an alternative to Medicaid expansion, and we think it's one that embraces free market principles. It actually puts over 400,000 people into private health care plans as opposed to putting them on Medicaid. It's sustainable. It doesn't rely on federal dollars that we can't count on. And so all in all, we think it's a great plan. I'm really proud of that committee and looking forward to the bill coming to the floor next week.
Why is it better than the Senate plan?
Well, I don't want to say anything's better than anybody's plan. Ours is just different. Ours does not rely on $7 billion of federal money. And the challenge with the federal government is we just can't trust them to fulfill their promises. This is a federal government that hasn't passed a budget in 4 years. It's a federal government that has a $16 trillion deficit. And we've just decided as the Florida House that our plan should be sustainable. We can pay for it with state funds, and we can also utilize the federal exchange that will start in January of 2014. And so we provide coverage to the most vulnerable and the most needy, and at the same time, we don't put our state at risk for a big tax increase down the road.
You know, in recent weeks we've seen a lot of press conferences, a lot of editorials, basically saying that it's not smart or even irresponsible not to accept the $50 billion plus from the federal government.
Well,
what do you think?
Well, there's clearly an agenda that's out there in a lot of areas that want us to take $7 billion of federal funds that is short-term money that we can't count on long-term to give people health care. The problem is the health care they want to give people is Medicaid. And we can show that giving people access to private health care insurance, Blue Cross Blue Shield, United, Aetna plans, is far superior to being on Medicaid. And so our plan takes 400,000 people, gives them access to free market private health care plans, and doesn't put them on Medicaid, which, as history has shown, is not the best form of health care you can get.
You know, the other argument we hear is that Floridians are sending their tax dollars to Washington and then they're not getting any return on those dollars.
Well, the good news about this is if we don't take the federal money, it doesn't go to another state. Hopefully it will go towards paying down the national debt, as we have a lot of challenges with. And so I don't think a good argument is expand a government entitlement program that has bad outcomes just because you're helping pay for it. We are going to be self-sustaining in Florida. And for us to be a prosperous state, for us to continue to grow and create jobs and be the best state in America when it comes to job production, we've got to make sure we're not creating an entitlement state. And that's what Medicaid expansion does. We have an opportunity to embrace and change health care and change the health care debate in Florida. I'm excited about it. We're looking forward to the next 2 weeks explaining to the citizens of Florida, to the Senate, and to the governor why we think our plan makes sense.
What do you think of the speculation that says you really don't want to accept the federal money because it links you to the president?
Oh, it has nothing to do with that. I said on the very first day of session a while ago that, we should not be wishing for our Congress or our president to fail. We want our president, we want our Congress to succeed because that means America succeeds. But the Supreme Court said that the Medicaid expansion was optional for states. And so we're taking them at their word. It's an option we don't think we should take advantage of because we've come up with a plan that will give people access to private health care insurance and at the same time not put the state of Florida at financial risk or potentially force a tax increase down the road.
Some think maybe a melding of the House and Senate plans is still an option. What do you think?
Well, we're always willing to negotiate and work with our friends in the Senate. The challenge is the way the federal government passed this law, it's an all or nothing approach. You either take all the federal money or you don't. They gave very, very little flexibility, if any. And so it's hard to negotiate. If the Senate wants to negotiate about how big our plan is and making it bigger, that's something we could talk about. If it's about taking federal money that's not sustainable, I'm not really sure we'll get very far.